Here's why you shouldn't strain when you go to use the White House. I believe as Nigerians, we all know what the White House is. But if you don't know, the White House is the toilet. Now, when you go to stool or you go to poo in the toilet, now, to be able to achieve that, what happens is that you push. Now, that push is when you push the abdominal muscles, the muscles of the abdomen, they contract. And that's why when you stool, if you touch your abdomen, you see that there's that, muscular contraction. Now, the muscles are trying to push, to help you push the contents of the small intestine out through the anus. Now, what happens is that when you push too much, or you've been pushing and it's not really coming out for different reasons, maybe because of your diet or the fact that there's not even enough water in the stool, and so you're having difficulties getting the stool out, that pressure on your stomach can actually push other things too. And so it could maybe even push the stomach or the contents of the stomach upwards past the diaphragm, and so people get heartburns. When you also push, it could cause a little tear somewhere in the urethra. And so somewhere along your anus, there's that tear. And so you see people go to the toilet, and after some time, their tissue, when they use the tissue, you see that there's a little blood. That's because that straining, that push has caused a tear somewhere in the anus. Now, the most common is what we call hemorrhoids. Now, what happens in hemorrhoids is that when we push that hard, the vessels in the anus, they get disturbed and they get inflamed. And so you see that protrusion. It's like there's a swelling coming out of the anus now when you stool, and it's almost as if you don't understand it. It comes and then it goes in and can be very painful. Now, that is what causes it. And so it's important that when we go to the washroom and we find out that, okay, we are not able to stool freely, it's important that you do not push. You should leave the pushing for the labor room. When you find out that, okay, you can push, or after some pushing, you find out that you're still not able to void yourself of your stool, what you should do is either go talk to your doctor or change your diet. You eat foods richer in fibers, you should take fluids, and that would help ease. But when you push, there are so many illnesses that can actually come from it. And so it's important not to. Try not to, come on. Till next time, it's your favorite doctor.